right, great. Thanks, everyone. I see the waiting room is 0, so everyone's here. So I'm going to just start afresh. Hi, everyone. Thank you for being here for the inaugural meeting of the Program Advisory Committee, or the PAC. My name is Dr. Gary Tsai. I'm serving as chair of the committee. Commissioner Madrigal-Weiss is our co-chair. I just wanted to start off by thanking everyone for your time and commitment to participating in this advisory capacity. I think all of your input will be helpful in us shaping the efforts that the PAC will be covering, focused on programmatic research and evaluation efforts. And before we take roll, I just wanted to check in with co-chair Madrigal-Weiss to see if she had any opening remarks as well.
Thank you, Dr. Tsai. I would just like to say very happy to be a part of this process and to be here to facilitate this. I'm looking forward to our conversations.
All right, great. Thank you. With that, let's take roll and establish quorum. Oh, also, just to note that under Bagley-Keene Open Meeting Act requirements, commissioners who are participating remotely have to keep their camera on at all times and will be asked during roll call to disclose if you have any other adults over the age of 18 in the room with you and the nature of their relationship with you. So with that, Sandra.
Got it. I'm asking all commissioners who are joining us online to unmute their lines to make this process easier. And when you say here, would you please disclose if there's anybody over the age of 18 in the room? And if there is, what is the nature of that relationship? Commissioner Baer.
Here. No one is with me.
Great. Commissioner Bernick.
Right here, and no one's with me.
Commissioner Chambers. Commissioner Cross.
I'm here all alone.
Commissioner Fernandez.
I am here and there is no one with me.
Commissioner Designee Swartz.
I'm here alone.
Commissioner Tsai.
Here and alone.
Commissioner Madrigal-Weiss.
Here and alone.
Perfect. Thank you. We have quorum.
Great. Thank you. All right. So moving on to agenda item 2 for announcements. Just some quick notes that we are abiding by Bagley-Keene for these PAC meetings, but as part of our commitment to deeper public involvement in open governance, we are relaxing Robert's Rules of Order in order to allow for more open dialogue within the PAC. We think and hope this will help to promote more open feedback between the committee and community. We think and hope that those here today will feel how this is, different than our usual committee meetings, although we still are following all of the Bagley-Keene requirements. It was a commitment made by the commission and Chair Alvarez to strengthen transparency and just ensure that we have some more open two-way communications between the committee and the public. We obviously want to hear about concerns, perspectives, solutions, and the aim is to hear from everyone who's interested in contributing to the agenda items that we're covering today. So with that, unless anyone else had any major announcements, I think we're good to move on to agenda item 3, which is general public comment. So this is for comments on items that are not already covered in the agenda. Grace or others, if you want to lead us through public comment, please.
Thank you, Commissioner Tsai. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair and at least twice the amount of time will be given to you during the public comment period. For members of the public in the room, if you have not already done so, please use one of the green public comment cards located at the front to indicate you would like to make comment on this item or any other agenda items. Cards can be given to staff located at the front table. Members of the public can also email us public comment to be shared at future meetings at publiccomment@bhsoac.ca.gov. I will now go over public comment procedures. Once the public comment period for the agenda item starts, we will close the public comment queue, so please make requests to comment at that time. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, please push *9. When it is your turn to comment, I will call on you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. For virtual comments, I will insert the word "last comment" next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. However, we are relaxing these rules for today's meeting to promote meaningful dialogue. We truly appreciate your understanding with this process. We will begin with in-room comments. And at this time, I don't see any. And moving on to virtual comments. And we have a comment from Dominique Weller. Your line is unmuted. You may speak.
Right. No more public comment.
Thank you, Lester.
Okay, great. Thank you, everyone. So moving on to agenda item 4, which is the overview of the Program Advisory Committee. So for this item, hopefully this will provide a good foundation of understanding around what the purpose and scope of this committee is. We'll be covering that. We'll make sure that there's some opportunity for any comments or questions from both commissioners as well as other participants. And I'd like to invite Dr. Melissa Martin-Mollard, the Acting Deputy Director of Research, Evaluation, and Programs, just to help guide us through a brief presentation outlining the core purpose of the PAC. Melissa?
Thank you, Chair Tsai. All right, if I can get the slide deck for this item up, great. Okay. So I'll start with just a quick overview of our committee membership, and thank you to those who have agreed to serve on the Program Advisory Committee. Dr. Gary Tsai fills the seat for a physician specializing in substance use disorders, and Vice Chair Mata Madrigal-Weiss is a long-serving commissioner representing student and school mental health as the designee of the State Superintendent of Public Instruction. The rest of our committee members make up diverse and varied voices, including peer voice, including those with lived experience with mental illness and substance use disorders, a representative with knowledge and expertise with community-defined evidence practices and reducing behavioral health disparities, Senate representation, and the seat representing a disability organization. This next slide shows the the research, evaluation, and program team at the Commission, which represents our data and transparency suite work. We also are responsible for Mental Health Wellness Act grant portfolio and associated evaluations, the Innovation Partnership Fund, and Behavioral Health Student Services Act grants and evaluation. So similarly to the other committees, our meeting format and frequency is as follows. We will always have the meetings as a hybrid option. So you'll be able to join virtually via Zoom or come in person to Commission's headquarters. We will meet every other month and on an ad hoc basis. And as previously mentioned, we'll be following Bagley-Keene Act rules. So you'll have the agendas posted 10 days in advance. And the committee members will be able to make recommendations to the full commission, but cannot take action. And then as Chair Tsai indicated, we have structured these committees to facilitate more open dialogue between our community partners and commissioners. So just quickly to review the committee charter, purpose, and goals. Primarily, the functions of this committee will be to review proposals related to research, evaluation, project and program development, and the related contracts and grants associated with those. We also are really excited to solicit community partner, peer, advocate, and other perspectives to identify programmatic priorities that align with the Commission's goals and objectives, and then to review program updates, report progress and outcomes on our grant portfolio and other projects, and help connect the dots between those portfolio projects for the full Commission. At this time, I'm going to turn it back to Chair Tsai to discuss the foundational pillars that underpin the work of this committee.
Yeah, so based off of some of our discussions in prior commission meetings, we thought it would be helpful just to propose some what we're calling foundational pillars. So really high-level categories of focus for the Program Advisory Committee to focus on. And so these are, as you can see, really big buckets. So youth, quality and integration, as well as workforce. And I think the benefit of this in our minds is really more around framing what some of the key focuses will be in terms of how this group will think through, you know, our responsibilities, some of the pillars by which we can help to make, you know, decisions aligned with the charge of the broader commission. And so, you know, we're happy to discuss this as we go through. These are proposals at this point, but we do think that they cover enough ground to allow us to focus on key priority areas that we've heard about in numerous prior commission meetings, that both from commissioners as well as from the public. So with that, Melissa, I'll hand it back to you.
Great, thank you. Okay, so the items that will require full commission approval that we will bring to this committee for discussion and input include under our grant programs, our RFP outlines and intent to award. For research and evaluation reports, we will make recommendations that will need to go to the full commission to adopt any evaluation and technical assistance reports written either by our internal staff or our contracted partners. And then lastly, related to our accountability and data tools, for example, our transparency suite, any dashboards and other public-facing tools that help us with transparency and accountability. Just to kind of give you, you know, today's meeting is really focused on Innovation Partnership Fund. And as we just, for those of you who tuned in to the Budget and Fiscal Committee, there will need to be, you know, coordination and communication between the two committees because, of course, with our program and grants, there's the dollars associated with it and vice versa. So some of the things that are upcoming action items include our FSP evaluation support. We have ongoing funds for the Behavioral Health Student Services Act. We discussed in the Budget Committee the $20 million annually for mental health wellness. Today, of course, we're talking about Innovation Partnership Fund. So we want to make sure to discuss these priorities at the committee level so that we can make strong, informed recommendations to the full commission. potential information items that wouldn't necessarily require an action from the committee might include updates on our grant portfolio, emerging practices or priorities, and then updates from key agency partners like CDPH, DHCS, HCI, and others who we might bring in to help inform and support the Commission's strategic goals. We also drafted a decision-making framework that we tried to be consistent with the other committees. And we would love to get input on how to make the tool more useful, how to center it on equity, and have it reflect the values and priorities of this committee and the full commission. So I'll leave that up for just a minute. And then just say that we, after some discussion on this, would like to make a recommendation to adopt this framework. So just some discussion questions to consider. Does the framework reflect the right values and priorities? Is anything important missing or not clear? Are there ways that we can make this tool more accessible and equitable? And then finally, what would help you feel confident using or engaging with this process? So with that, I'll turn it back over to Chair Tsai to see if there are any questions or comments from committee members.
Great, thank you, Melissa. So we'll open it up for commissioners as well as the public. Unlike our commission meetings, we're going to try a process where we don't have any, timer in the background. We do ask that people be as concise as possible, and for time reasons, if comments are prolonged, we may ask commenters to close up their comments. So just with that caveat, any comments, questions? I'm sure there will be, so we'll pause.
Chair Tsai, are you asking for from the public, from everybody in the room, from commissioners, just to be clear?
Actually, let me see. Are we?
We start with commissioners?
Yeah, let's start with commissioners. Thank you. So for the commissioners.
This is Commissioner Bear. I have a question. What I'd like to know is, based on the set of roles moving forward, is there a way to create some kind of public format without the staff being just overwhelmed? In the world we live in today with social media, versus just going through the CBH site, or whether it's LinkedIn or something business-wise that way, because there's been some people in the community on the community level that have asked me.
And Commissioner Bear, just to clarify, are you saying for things like the PAC meeting information and dates, links, etc.?
No, more how to, if they let's say they apply into something on the innovation fund, what the follow-up side is, and if there's anybody on staff that can track that, or are there social media outlets that they can link into?
Got it. Okay. I don't know if Brenda or Melissa, you want to cover that?
Can take into consideration, and I think maybe we could talk about in the IPF conversation for that agenda item, and So I don't know if we'll have a response today, but it's something we can definitely talk about. And I think right now for the agenda item is on the infrastructure for the program advisory committee meeting and the decision-making framework. I think the question on the table was, how's that look? Does that look okay for everybody, for the commissioner standpoint? So Commissioner Barry, are you okay with us just tabling that to the second part of the agenda on the IPF?
Sure, but it's a part B to setting those standards now, correct? I mean, it would be
Oh, the
something.
decision-making framework, yeah, I mean, it's kind of overarching, so it's not just
Okay,
IPF, it's for all the work that this program advisory committee is going to do, just to have some sort of anchoring to a framework. And like Commissioner Sider, Chair Sai had mentioned, it's not a static framework, it's a framework that can be evolving over time as needed. So
perfect.
just point of departure for everybody to anchor to as we get started.
Right.
Thanks, Commissioner Bear. Looks like Commissioner Fernandez.
Sure. Thanks, Commissioner Sai. I'm in agreement with the impact and equity, landscape and value and potential outcomes as it regards to the PAC decision-making framework. I do want to point out that there seems to be a lack of congruence in the alignment section insofar that there's two questions that sort of juxtapose one another. One is, does the proposal relate to the implementation of BHSA? Directly thereafter, it talks about aligning with the strategic plan of the commission that was drafted under the MHSOAC, which does not take into consideration any substance use needs. So I want to make sure that as we move forward, that while we are looking at the previous strategic plan that was drafted that takes us through 2027, that the PAC is open to the needs of substance use disorders, individuals with substance use disorders, and taking a lens that focuses exclusively on their needs as well as the mental health needs of Californians.
And Brandon, in terms of the alignment that you're referring to, I'm assuming you're referring to one of the slides, is that right?
Yeah, I don't know if the slides are still up. Sorry, now I'm looking at all the folks in the room, but
Put it up. Yeah, I can
Go back
it up
one
here.
Yeah.
there was a PAC decision-making framework. My understanding is that right now we're asking whether or not we're okay with the proposed decision-making framework. Is that correct?
Yes.
Correct.
So that's it. It's on this it's in the far left alignment. Does this relate to BHSA? So I think, yes, we should be looking at it through that framework. I don't know that it's as important to make sure that it's aligning with a strategic plan that is now outdated. And I'm not saying wholly irrelevant, because I am confident that there was a lot of work put into that document. But as I've reviewed that strategic plan, there's no mention of substance use.
Got it. Okay. So that's a good point and catch. And I guess because I am also one of the newer commissioners, the strategic plan, and I know it's come up in prior commission meetings. So that was developed entirely prior to BHSA, is that correct? And this is a question for the staff, I think.
Say prior to, but in anticipation of, but it does need to be updated. And that is something that I'm working on with the team, is a process to get it updated. So maybe we put a caveat or something in there now, just to say that there's some special considerations, but really it ties to the BHSA. So
Yeah, okay. I think that's a great point, Commissioner Fernandez. And I mean, one of the reasons why one of the pillars is focused on, quality and integration, kind of underlining the integration with respect to your comment is, there is a desire to ensure that we're focusing on the spirit of BHSA, which is both mental health as well as substance use priorities. So thanks for flagging that. Other comments and questions from commissioners, particularly on the decision-making framework? Hearing and seeing none. Perhaps, Grace, we can move on to any public comments or questions.
Yes, thank you. At this time, members of the public may request to make a comment on agenda item 4 by clicking the raise hand button on your computer or the app, or if calling in by phone, by pushing *9. If you're in person, please make sure you have turned in your public comment card to staff at the front table. We will begin with in-room comments. When your name is called, please proceed to the podium to make comment. Commissioner Sai, we have one comment in the room. Stacy Hiramoto.
Hi, Stacy.
Hi, Commissioner Tsai. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I'm very sorry. I really try to be positive, and I wish you could have been at the meeting before because I was really positive, but I must object to you voting on this today because I do not believe these slides or this information was available until very recently. I have tried to go on the website and I did print out the materials for this, and I kept going back and I did not see this PowerPoint. And so this PowerPoint is the first I am seeing of it is right now. And particularly on the discussion of the foundational pillars of youth, quality and integration and workforce, it's not that REMCO has objections or does not favor these things, but to say that they are the foundational pillars for this committee, I think we need a discussion on this. We have, there are many people that have been coming to this commission trying to get more equity focus and services and programs for BIPOC and LGBTQ communities. And these do not, unless they are really fleshed out, do not speak to that, and or reducing disparities. And I'm just really, again, I don't know when these materials were put on the web, so I apologize if they were put a week ago and somehow I wasn't able to access them. But when I see something, you know, just presented here, it's really, it just sort of jars me because I don't know. And one of the things that this commission was excellent at was whenever you used to post new materials for the meetings, then there was an email that went out. Now, I know that that is not being done currently, and perhaps it's because you have all these new committees, and I understand it's a lot of work, or maybe, you know, you're going to start some new procedures. But I watch very carefully for emails from the commission, and I do not see one that says that additional materials were posted. So I'm sorry, I just have concerns about you adopting when I have only seen this PowerPoint, and then there's no hard copies here, like at the last committee meeting they had. And at least I could have looked at it like 10 minutes before the meeting or whatever. But now I'm sort of like all discombobulated. So thank you.
Got it. Thank you. And so I think, just looking at Sandra, I think we can have like a back and forth and respond, right?
Absolutely, yes. That's what why we did it.
Yeah. Oh, great. So, I mean, a couple things is on the material, I think the intention was to have the slides available. And if that wasn't the case, Brenda, Melissa, I think that's something that can be easily remedied in future meetings. Is that correct?
Yeah, and I think they were posted yesterday. So and I think it but I think we'll try to see what we could do to figure out how to make it a little earlier, and we actually are talking about that already. So but the point about sending out an email beforehand too, that's we can definitely do that again. So move the time emails. That's something we can fully do.
Great. And so and I just want to also just address Stacey, your comment about the pillars, you know, the three pillars being youth, and then quality and integration, and then workforce, right? The intention of that isn't to exclude really anything, right? The intention actually was for those to be very broad categories that we could fit a lot of focuses under. So whether it was LGBTQI or BIPOC priorities or whatever, all of those actually fall under those is what we were imagining, but you know, do appreciate your feedback on that. All right.
she has one more.
Can I answer, since this is going to be different than before? So I have been in the mental health community for many, many years. And of course, I want to see many, many programs and funding go to youth and children. So again, I don't want this to be like, I'm opposed to that. What I will say is when categories such as particularly children and youth, you have a category like that, and then there is a grant proposal or an RFP put out, and then people say, well, how are you going to serve racial and youth from BIPOC communities? And then what they say is, oh, well, the majority of children in California are from BIPOC communities, so that's how we're going to serve. I mean, that's often what is put in grants and you can grant proposals, and that's accepted. So, I mean, I'm sorry, I'm just kind of sensitive to this because, yeah, it's true. The majority of children and youth in this state are kids of color. But that doesn't mean that when the mental health programs and money is distributed, that the proportion of those funds go to children of color in that proportion. It really does not. So anyway, I'm sorry, that's why I'm sensitive. And, if I could just have a little time to look at the materials, maybe I'll calm down. But anyway, thank you.
Thank you, Stacey.
And I was also just going to maybe clarify that the vote or the consideration for this is actually just on that decision-making framework, not on the program structure too. So just so that you guys know, it's clear for everybody what would the vote would actually specifically be. They need to.
And
Great.
Commissioner Tsai, we do have some virtual comments.
Great.
We have 3 total. The first comment is from Ruqayya Ahmad. Go ahead and unmute.
Hi, my name is Ruqayya Ahmed. I use she, her pronouns, and I'm from the California Pan-Ethnic Health Network, or CPAN. Just want to reiterate Stacey's point. This was the first time that I was also seeing the decision-making framework, I guess, because it was added yesterday. And so I think just like given how central the framework is in like guiding funding decisions, I think one day is not really enough time for community stakeholders to really review and like provide meaningful feedback. So, in like the spirit of transparency and equitable participation, we really do hope that the committee provides this types of materials earlier in the process moving forward. And then in just looking at the framework itself, I had a question about what sort of role community members will have in the review process. And then also, is the commission planning on incorporating any sort of like equity rubric or scoring tool that's going to be aligned with the framework? And then if so, like who or how will the scoring criteria be developed? And then lastly, it would be great to also include maybe a question around the proposals of like, what is the plan for measuring the impact and like ensuring equity goals are met during implementation of the proposals? Thank you.
Great, thank you. I may have missed the first one, but on the equity rubric, I think that part of the thinking, and Brenda, co-chair Madrigal-Weiss, and others, I invite you to weigh in too. Part of the thinking around the decision-making framework is to specifically call out impact and equity and to frame what are some of the key questions that as the group, and when I say group, I mean broadly, right? Commissioners as well as the public participating, as we consider different projects and proposals, that we think through some of these questions, right? So like, does the proposal advance equity for marginalized or underserved groups, so that those considerations are framed in. I don't think that we had talked about using any particular tool, but I don't know if Brenda or others want to weigh in.
I think it's just a broader, just like kind of thought, like a decision making in terms of thinking of the work separate from like scoring RFPs. So that's a whole different thing. So so I think this is just kind of guiding the work of like a decision making work to guide the work of the committee versus once there's a decision to do an RFP, that's a different process.
Yeah.
Yes, I think that's in discussion. That's exactly how it was framed. So it's two different things that we're talking about. So I don't know. I think we also talked about through these conversations, we would, as time goes on, we would flush it out together. But this is just to begin somewhere. These were the big categories, nowhere close to fine tuning it or deciding that this is only what we would focus on. I mean, so there's a lot of room still. So to Stacy's point, I don't want us to think that it's only this and we're not fine tuning any of the decisions. And in all fairness, you know, I hear what is being said. If you haven't seen this and we're saying, let's have dialogue around this already, you know, a lesson learned for us. So I want to really give grace to that. We haven't seen it, not even 10 minutes before. I'm not looking at it now, Stacy, to what you're saying. So, oh, okay. Point heard. We have more meetings. It's not all or nothing right now. So we're learning together. So I just wanted to add that.
And I was just saying, maybe also helpful, it's to have a framework across all the committees because Lex and the Legislative and External Affairs Committee and the Budget Committee have also got pretty much the same as it relates to them framework going to. So it kind of keeps some consistency across our committees so that even as people participate across the different committees, then it's very solid and as uniform as possible, some standardization.
Yeah, I mean, today is our first meeting, so I think we will, as we demonstrated with the initial technical issue that we had, we will work through inevitable hiccups. Rakai, I know you also had a first question about what the community's role will be with respect to the PAC, I believe, and I think that the reason why we wanted to relax the Robert rules and to be able to have more of a back and forth is that these meetings that we're convening are the opportunity, for us, for the public to hear kind of what the commissioner discussion is around the topics that we cover in this meeting, as well as for the public to directly weigh in and help shape the perspectives. This group won't be taking any actions, but we will be making recommendations to the broader commission, right? So hopefully that helps to clarify that this is really intended to be a more open discussion. Okay. Grace, should we move on to the next?
Yes. The next virtual comment, Joel Baum. You are unmuted.
Thank you so much. And again, I want to reiterate both Stacy and Rakaya's comments, so I won't be too long. Hey, I love a framework, a good framework as much as the next guy. I think frameworks are super helpful. I think they really do help guide our work. But I think this also is a really important precedent we're setting. It's the first meeting. We're really looking at this work in new ways with Prop 1 and its passage. And so I do just want to echo the importance of I think I probably say this in every single time I do public comments, measure twice and cut once. As you're establishing processes and structures for these critical conversations, I really hope we can kind of make sure we're meeting those process goals. And while process can't be everything, given some of the goals that have been stated around equity and inclusion, I just want to make sure that we don't kind of return to business as usual and say, oh, yes, we do need to do better. And then kind of it's business as usual. So I do want to appreciate the intent of the commission of the PAC to kind of have a different kind of conversation than we've seen in other meetings. This back and forth that's already been demonstrated, I think, is really great as opposed to this sort of unidirectional comments. But I want to appreciate that. But, we are setting some really important precedents at this point. And so even with, quite honestly, the making of a decision around or the endorsement of a decision-making framework, I would encourage you to think about maybe holding off till the next meeting because you've heard from a number of people, you didn't give it enough time, people didn't have a chance to review it, and that's your commitment to transparency. So anyway, thank you. I do appreciate the opportunity and again, the effort to be really engaging in this way.
Appreciate it, Joel. Thank you. Grace.
To our final public comment, but before we do that, I just wanted to call out that Commissioner Chambers has also joined. And we're going to go to our final comment. Carolina Reyes, please proceed.
Hi, everyone. Thank you, commissioners, for your time. My name is Carolina Reyes. I work with Safe Passages, and we're also a member of the CRDP, or California Reducing Disparities Projects. I also won't take up too much time. I just want to echo everything that Stacy and Joel had mentioned. And while I recognize that this is sort of the first step, like you all mentioned, right? It's an ongoing process. I do just really want to focus on the importance of the specificity of language that will ensure we really include and think about BIPOC and LGBTQ plus communities. In the past, I think sometimes more general language of disadvantaged folks, discrimination, that might have been enough before. But I think, especially now, given everything that's happening at the federal level with the budget cuts and policies really targeting these communities, it's essential that the state steps up and does things a little differently, especially with this focus and specialization, to ensure that like our communities are buffered, you know, with all this constant attack from the federal level, that protection from the state level and that specificity that protects the policies, that protects the funding for our communities. Again, it's essential now more than ever. And I think utilizing specific and intentional language will help ensure that the funding goes towards these communities. Thank you.
Thank you, Carolina. It's helpful comments. I think we had Commissioner Chambers on and then Danny. I just noticed that on Zoom, we do not have the numbers that help us determine who raised their hand first, so we'll just do our best. So apologies if we don't go in an exact order, but Commissioner Chambers.
The only reason why I had my hand is up is because no one could see me. I'm fine. I don't have any comments.
We can
Got
see you.
Thank you.
Well, no, you don't.
All right.
Commissioner Tsai, we have one more comment online. Danny, you are unmuted. Please go ahead.
Hello, can you hear me okay?
Yes, we can hear you.
Perfect. Thank you so much. My name is Danny Therical, Public Policy Coordinator from South America, California. I just wanted to voice a little bit of, slight concern with the alignment part, as it pertains to, does this proposal relate to the implementation of the BHSA and or the state's behavioral health transformation? Just wanting to really point out, part of the behavioral health transformation, there's been a lot of work with expanding forced treatment and 5150 eligibility, who can write holds under this state guidelines or state movement. So I think it's really important to call that out as concerning to the our organization as a peer-run organization, wanting to make sure that we uplift and hold people's rights and civil liberties as something that should be highlighted and protected, and that having the state's behavioral health transformation as an alignment part of the decision-making framework might pose some potential challenges as discussions around different programs are created.
Thank you, Danny. Yes, I mean, this is a bit technical, but on the alignment piece, when the term behavioral health transformation is mentioned, I just want to highlight, it's actually referring to the state's defined term of behavioral health transformation as opposed to a more generic reference. And so, the state is referring to things like, CalAIM, BH Connect, the CYBHI, which is the Children and Youth Behavioral Health Initiative, et cetera. But certainly hear you that with various changes, assume you're referring to things like Care Court or Care Act and, Senate Bill 43, et cetera. There have been shifts in terms of, how people are receiving involuntary services, right? And that's certainly something that we're mindful of and the group should be mindful of. So thank you for your comment. All right, so it looks like there are no other comments or questions that I can see. I do want to just reiterate, certainly here, I think we have every intention of sharing information sooner rather than later so that everyone has an opportunity to review. And we'll definitely be keeping that in mind for future meetings. So thank you for that. Okay. With that, and seeing no other comments or questions, it looks like we can move to item 5, which this is one of the key focuses of today's meeting, and that's discussion around the Innovation Partnership Fund, or IPF. This item will include the planning, framework, collaboration, and dialogue with respect to implementation of IPF funding. Will also be led by Marko Mijic, who led a discussion at our last commission meeting in May, if for those of you who are participating. I think Sarah Brooks will also be here, and we'll be seeing Sarah in future meetings as well. And so with that, welcome back to the commission, Marko. Thanks for joining us, and feel free to take it away.
Awesome.
Sorry.
Thank you.
Can I just make sure we weren't going to do a motion to adopt the decision-making framework?
I mean, I don't know if I know there was some confusion on what the decision-making framework was or is, and that it's more of kind of a discussion, like a working kind of framework for us to do our work for the PAC, and has nothing to do with RFPs or anything like that. So I don't know, maybe given that, I mean, we could put it on to the next meeting and have it as an agenda item, or if the commissioners feel that they want to move forward with a vote to adopt the framework, knowing that it can evolve and change over time as we continue to learn. And that's basically how the other committees have adopted it as well. And then we would want to make sure that even over time, we're keeping that framework as standard as possible amongst the committees. So again, it's just a framework to do the work.
And Brenda, just a clarifying question. If we were to carry the framework discussion to the next meeting, is there any kind of problem that would create, or?
I don't think so. No,
Okay.
I mean, it just delays it. It just puts more time on another agenda for the item. But yeah.
Do we
Okay.
need to make a motion if we adopt it now?
And you guys always change it too. So if something comes up,
Yeah.
it can be changed at any time. So it's not set in stone. It's not a one and done.
Yeah, I move that we adopt it now and move forward.
Okay. And actually, just a clarifying question for me, Sandra, because I know that I've been in my mind trying to avoid the term motion just because we're not taking any actions here.
Yes.
But
And
are we doing?
Right. Okay.
This is Sandra. It is, you're recommending, right? So it's very tricky because we are not a decision-making body. So
Mhm.
yes, you're very correct to avoiding the word motion, but it's really hard because we're so used to using that wording, and it's clean to be able to do, we have a first and a second, kind of thing. But if you decide as the chair to move the motion forward, and it sounds like you have a first, you could ask for a second, and I can go into the vote, or you can choose to postpone the motion for the next meeting.
Got it. Okay. I mean, Coach, I'm thinking maybe we can hear from the other commissioners and just like, what is the general temperature based off of what we've heard and, everyone's perspective on the framework.
Well, I think I'd just like to reflect on the fact that there wasn't a lot of discussion, and I think some of that might have to be just because the information wasn't out there. So just to honor what the purpose of these types of meetings were, it was to have more discussion from the community and our partners. So if there is going to be no harm in extending, then I think the information is now out there. We can extend it to have more dialogue, knowing that this does not change the RFPs in the process, but just in full honoring of this process. I would like to see it extend into the next meeting.
It sounds reasonable to me. All right, let's do that. Melissa, hopefully that clarifies. We can move on to agenda item 5. Yeah.
I'm out. Oh, here we go. Thought I was out of juice on my mic. I think we're good to move.
Okay, great. Marco, you want to take it away with IPF?
Yeah, thanks so much, Commissioner Sai, and to both Commissioner Sai and to Commissioner Madrigal-Wise. Just thank you for giving us this space to continue to iterate on this concept of the Innovation Partnership Fund. I do have some slides, and the idea here really is to engage in a lot more conversation. We're not taking action on anything, so I just want to be very clear about that. And I also want to note that in the meeting notice, I think 10-day meeting notice, we did include a working document that is a few pages long that outlines all of the pieces that we're looking to discuss in this particular item. So I think someone has my slides, or if you need me to pull them up, let me know. Should I pull them up myself?
I think it would be better if you can share your screen to go ahead.
Okay.
They're up. Oh, they were just up a second ago. Sorry.
Right
Okay.
now. You just say next
All
slide.
right. All right. So I think if you hit next slide, I just want to put this here, and we're going to build out the dates. I just want to level set in terms of what the process looks like so people understand. And we'll talk a little bit more, but really the idea is that we're starting this learning journey, as Chairwoman Alvarez likes to say. And so we are using the Program Advisory Committee as a mechanism to delve into, roll up our sleeves, and talk through more about this. For those of you who are from a public side, we are also going to do a series of virtual community engagement sessions, and you will see we'll do one in July, probably July, August, designed to, again, begin to engage people in community. We also will do a lived experience session with just people with lived experience. And then we'll come back in September to the Program Advisory Committee to further flesh out these pieces, with the idea that in October, this goes back to the Commission. So this is kind of our journey, our learning journey together. Some of these things might change and we may adapt, and the dates may change. We're looking to finalize these dates, but this, just to give everybody a clear sense of process, this is the timeline of what we're thinking about. If you can hit the next piece and hit it a couple more times. Great, stop there. So how do folks from the public engage? I think this is an important piece, and I'm going to start with this and I'm going to end with this. Obviously, continue to participate in the work of the Program Advisory Committee led by Commissioner Sai and Commissioner Madrigal-Wise. So I think look for meetings like this. We encourage you to look at the Commission for Behavioral Health website. Once we have this timeline published, we'll have the virtual community engagement sessions. We'd love to have people distribute that information and share. And then please provide us feedback via written feedback online through the Community Behavioral Health, Commission on Behavioral Health website. So those are kind of the mechanisms of ways in which you as a layperson, as a loved one, as a person with lived experience, as an individual who is a part of an organization that cares about these issues, can engage in these processes. Next slide, please. So I want to provide a little bit of context for those of you who are new to this conversation. This particular piece has been part of the commission for a few meetings now. Many commissioners have engaged in a conversation about the Innovation Partnership Fund, which is being authorized by Proposition 1, which passed last year via the voters. And the idea really is how do we continue to build the skeleton of what this really would look like? And so we heard a few things through these various conversations. So if you can hit enter a couple of times here, and you can keep hitting enter. We heard a number of different things that I think are representative of this slide. And what we heard most clearly is that this needs to be centered in community, and that it needs to have the various pieces outlined here. I shared this slide last time, but I'm sharing it again because I think it's just important to highlight kind of where we are and what we're doing. When I think about the conversation today, I think about it in 3 different buckets and think about it as an onion. So the idea of the framework of how we build up the Innovation Partnership Fund will have multiple components. We're going to try to chunk this out by multiple layers. So the layer we're discussing today is going to have 3 components. One, we're going to talk about how do we define innovation. We're going to talk about the pillars of investment. So what pillars do we want to invest in so that we can prioritize? And then thinking about cross-cutting priorities. What are the cross-cutting priorities? So we've begun to put some shape to these things based on what we heard from folks before. And we're bringing it now to this group for further conversation. The working document that was shared with you 10 days ago as part of the announcement for the committee agenda further delves into that. So I encourage you to look at that. And today is not the only time that you can provide us feedback on that. Again, we're going to iterate on this together. So feel free to reach out and tell us, maybe we need to define innovation this way and not that way. Maybe we need to emphasize this over that a little bit more. So just encourage you to engage in that conversation. All right, next slide, please. So I want to just remind folks of the target population because this is part of the statutory framework. So if you go to the next slide, please. The statutory framework in Welfare Institution Code outlines, and if you hit the next and the next ones, the various pieces that these funds are designed to focus in on. So I just want to anchor us in really, as we think about the Innovation Partnership Fund, that the focus on the projects that would ultimately be funded look to advance the work of these specific populations. So I just want to remind folks of that and adding it here. If you go next. And then again, the premise of the Innovation Partnership Fund, or the purpose, is also outlined in the statutory framework that both passed the legislature and then was before the voters. And so just want to kind of emphasize that grounds the work. Okay, next slide. So here's where we're going to engage in conversation, right? We put kind of a definition together to narrow the focus. And so I am going to kind of, in the paper that we shared, we outlined this in a little bit more detail. But here, what I'm going to I'm going to read this so that folks have a minute to kind of digest it. Again, this is not the only time you'll be able to provide comment on this, but the idea of innovation would be defined as a new or adapted approach to solving persistent problems in California's behavioral health system, especially those that relate to equity, access, workforce shortages, and service fragmentation. To be considered innovation under this fund, a project must, again, this is just an idea. So if you don't see yourself, or if you don't see these things, we put something on paper for people to react to. This is not in stone. We're not taking action on this today. I just want to reiterate that again to folks. So advance new models, tools, partnerships, or technologies not yet widely implemented in California. Introduce or scale practical community-centered solutions that increase access to prevention, treatment, and recovery supports, particularly for historically underserved populations, and inclusive of harm reduction approaches. Demonstrate a clear break from the status quo, not simply incremental improvements to existing programs. Be actionable and ready for real-world implementation, not solely focused on concepts, research, and pilot testing.
And finally, not be designed to supplant or replace existing public funding streams or be backfill lost or reduced funding for behavioral health services. So our attempt here was to put a definition together. And so I'm gonna, with Commissioner Sai and Commissioner Madrigal-Wise's permission, engage now in a conversation with the public and the commissioners. Like, what do you like about this particular definition? What do you hate about this particular definition? What would you like to see changed in this definition? So we'll pause here and just kind of engage in conversation on this particular item.
Thank you,
You can
Marco.
actually go back. Let's just keep it on this so that people have it to reference. But we'll open it up for if Commissioner Sai, you're comfortable with it, this would just be kind of a place for conversation.
Yeah, thank you, Marco. Very helpful. Let's open up to the commissioners first, and then we'll go to the public after. Commissioners, comments, questions on the IPF? Commissioner Fernandez?
I have 2 points, and I think one, I think I really appreciate the general definition of what innovation is and what sort of a fun project needs to look like to meet that criteria. 2 points. The first one is in regards to the first bullet point about not yet widely implemented in California. As I read and reread this, it begins to make more sense. I do want to say, though, that different counties in the state of California are at very different sort of points in terms of their maturity or sophistication, in terms of different programs that they've implemented. I do think that we should make room for certain counties to be able to either re-envision or implement programs that have been established in other counties by either community-based organizations or other types of health systems, so that they can innovate within their own counties. And clearly those need to be remade. I'm thinking specifically of rural counties sort of reimagining what's being done in larger counties that have larger budget sizes. And so while I appreciate that it should not be widely implemented in California, I think we need to make room for saying that this is something that could very well differ county by county, and that's something we would want to take into consideration.
I love, can I just, I love that point of feedback. I think what I'm hearing you say, and I just want to be really crystal clear, something might work really well in San Diego County that's widely adopted. And if I want to look at it in Alpine County and be able to scale it in Alpine County, you want to have that flexibility to be able to do that. Is that kind of the gist
That's precisely what I'm saying.
Okay, perfect.
The second point, and thank you for that clarification. That was perfect. You did a much better job of explaining that than I did. The last point about not being designed to supplant or exist, and I agree with this. And this is going to be in regards to essentially bullet point 3 and 5. I do think that a lot of programs, especially in recent years, have received grant funding to try out new pilot programs. I recognize that it's innovative, and so we want to see, I guess, some sort of leaps that we're making. I also think that by definition, all progress is in some ways incremental. And so we want to make available opportunities for providers to advance upon the gains that they've already made with other funding sources, using increased funding, especially during a period where there's necessarily going to be funding cuts, and we'll see reductions made. And so I want to make sure that we don't just stop providing momentum to pilots that are winning right now because it's a definition that we've established of what actually meets the criteria for innovation.
And I really thank you for raising that. And I think others will probably chime in here. I think this one probably is the most controversial bullet point that I think is going to get a lot of people's feedback. But I think what I'm hearing you say here too, which I like, is there are things that we might have invested in to pilot. And so the scaling component of that, if it's working, we should be able to leverage these dollars to be able to scale that, for a lack of a better term.
Agreed.
Okay. All right. That's super helpful. Thank you, Commissioner Fernandez. Other commissioners?
This is Pam Bear.
Hi, Commissioner Bear.
Hi. It's great work what you've done. And just to piggyback on those comments, is look at the pilots that are working, but the ones that did not work and why. Why, and the equity metrics, you're acting on, not just reporting. And looking and taking it even a step further with that, to be thinking about private companies that are potential partnerships.
Commissioner
You know,
Bear,
I look at,
just
I as an example, Epic,
uh-huh.
you know, looking at zip codes across the state level. And
are you suggesting, just to unpack this a little bit more, are you suggesting, for example, perhaps somebody funded Project X, and Project X, based on certain metrics, maybe was not as successful as we had hoped, but the funding request here is to take Project X and to make Project X look different to address the failures that might have happened, not failures, but perhaps learnings that have happened as a result of that. And so not being able to not fund such a project when you're actually learning from past experience and adapting from past. Is that
right?
Kind of?
Yes,
Okay.
exactly.
Okay.
Just the entrepreneurs, these entrepreneurs call it pivoting.
Yes.
And
yes,
let's
I
be
hear you.
able to pivot.
I hear you. Thank you for that feedback. That is really, really good. Any other commissioners before we get into the public concepts of this? Okay, Commissioner Sai, I don't want to get in trouble with you. So are we okay to go to public comment?
Let's pivot to the public. I see Jerry's hand up.
Actually, there is one in the room currently.
Wonderful.
Stacy Hiramoto, did you? Okay. Oh, can you use the mic? Sorry, hold on just a moment.
I'm calling her to the mic. Stacy here, but go ahead, Stacy. Don't run.
I had submitted that for the other, I guess in general, and I don't want to always talk, so I wasn't going to say anything, but I do generally support the definition. I think it's good. I don't have, criticisms, and I'm really glad that Commissioner, and now I forgot his name, brought up the last bullet, though, is a little bit tricky, that one, but otherwise, and if you can define at some point what community centered is, but otherwise, I like the definition. Thank you.
Thank you for your feedback.
Thank you, Stacy. And currently we have 2 virtual comments. The first one is from Jerry Hall. You are unmuted. Please go ahead.
Hi, Jerry.
Hi, everybody. Jerry Hall out of San Diego. I am a big champion of the Innovation Partnership Fund and had some feedback, and I'll submit it in writing as well. But I'm going to read some of this, and that is that I urge the Commission to embrace a lean startup methodology for the Innovation Partnership Fund, one that prioritizes user-centered design, rapid iteration, and authentic community engagement over traditional top-down program development. Rather than developing solutions we believe communities need, we have to build what they tell us they need. And in the real world, in the entrepreneurship world, you don't build something until you intimately understand your customer's perspective and their pain. And then you build what's considered in the lean startup model, you build a minimum viable product, something that addresses the situation. It may not be pretty, but it's a solution test, and you go test that on the market, and then you keep iterating and keep building on that. So rather than spending a lot of money developing something that may not work, which traditionally we're great at doing, you build something that proves to work, and then you keep building on that. And there's a concept called failing fast, and you want to fail fast because you want to learn what's not working inexpensively. So some other points are, developing, when we develop solutions, we have to publish data. We have to publish and provide tools to use that data so that stakeholders can test their hypotheses and give presentations and public comment on a more informed basis. But that's very difficult to do with 3 or 4-year-old data. I recommend also creating a small incubator using, I recommended 5% of the fund, but it could be any amount. But the idea is get an incubator going that allows small projects to germinate, or you're planting seeds and seeing what'll grow. And the idea is if you engage the community and entrepreneurs, you'll end up with a lot of great ideas. But if you have a really bulky process, it's very difficult to navigate. And another point is to embrace critical commentary. I think we all learned in marketing that when somebody doesn't like a service, they tell their whole network or a large percentage of their network. When they like something, they tell very few people. So the point here is that when somebody's complaining, they're actually speaking for another 50 or 100 people, and I think we tend to shy away from critical commentary because it hurts, but hurts our feelings. But I'm a lifelong entrepreneur, and I'll tell you, if my feelings and my feelings have been hurt many times, and I've lost my life savings many times. But the point is that if I didn't learn from my mistakes, I wouldn't be able to succeed. And finally, the last thing is, we need to get reports from the program entities. The people that are doing this work need to tell us what they tried, what they were successful at, what challenges they had, and then publish that so that others could learn from it and maybe build on it in the future. And I'm sorry, but I want to support Commissioner Bayer's approach of looking towards the private sector, because I think one of the things we do is build programs, and when the funding stops, we cut the program. So that affects a lot of people. But if we can find ways to ethically sustain businesses or programs and services with community support and corporate support, I hate to suggest, but the point is that they have a lot of resources that they could dovetail into our project successfully, but we would have to have some really strict guidelines and guardrails. Thank you very much.
Jerry, thank you. I think it would be good if you could share that in writing. I think that you're getting at multiple layers of the onion. I think we're starting at the outer layer, which is the definition. But I think that there are a lot of things that you allude to that I think fall into the other layers that I think would be helpful for us to get. So if you could send to the commission your written pieces, I think that would be super helpful. Is there anything specific to the definition? I know you alluded to the last bullet point, and you alluded a little bit to the lean methodology. I always tell my team, fail fast, fail small, and fail forward. And I think that could be in the cross-cutting priority areas, which we'll get into in a minute. But is there anything specific to the definition that I just want to make sure that there's nothing that we missed in terms of your feedback on that? And you're on mute if you're talking.
Okay, there we go. My only consideration is that we need to be innovative of how we're doing this whole innovative approach. And so I don't mean to be facetious or circular thinking here, but this is a great start. And I don't think, and I'm sorry I haven't been involved in the last several months, because I understand you've been working on this for a while, and I didn't know that, because I would have jumped all over it. So, but I do think that the reason we're afraid of innovation is because it hurts elected officials' reputation, and it might affect their career. And I'm just going to say that to be frank. And let's talk about the elephant in the room. The reason we're scared of innovation is that it can make somebody look bad, and that's ridiculous. If people in the corporate world were afraid of looking bad, we'd all be living in caves still. So it takes entrepreneurs and it takes failure to find something good and something that works. So if we don't have this attitude of, and I think it's something that we have to teach Californians, and especially the politicians, is that we want to celebrate politicians that support innovation and support failing fast and finding solutions that are really community centered. And one example of that is that when we're talking about people with diverse backgrounds, we can't just publish the thing in a different language and say that we've checked off the diversity box. the solutions we come up with have to be presented or discussed and decided upon in the context of the individual person's language or cultural history. And for us to try to, we paint a diversity box and say it's diverse because we published it in multiple languages is laughable. We have to think about when a refugee population is coming from a war-torn country, they have a whole different behavioral health perspective than we do. So I just hope we sow that
Well,
in there.
I appreciate that, and I think our intention in kind of creating the community forums, we're looking to do those maybe at night and over the weekend to create more space for people to engage, so not just during business hours. And then I really think in terms of how we structured this to be able to engage, I welcome your feedback. All right, who
Hey,
is
Marco,
next?
sorry.
Yes.
Real
Go
quick.
ahead, Doc.
We have 5 hands up. I know that we had an agenda item at the end that we needed to cover too. I think this meeting, I just want to check, ends at 4:15. Is that correct?
That is correct.
Okay.
Okay, let's get through this, and then we'll skip one of the pieces, and we'll get into the cross-cutting component. So we'll make this, we'll continue to engage, and I'll shorten my pieces. So who was next in the queue, so that we could just get through as many people?
The next commenter is Eba. Eba, you are unmuted and may proceed.
Thank you so much. I want to echo what everybody has said so far. And I just want to say to Jerry, I'm an entrepreneur as well, and I've been part of the CRDP project for 8 years. And Jerry, if you are not familiar with CRDP, I really suggest you go to the CBH website, because what we have is models that have been proven in the state of California, but are not widely implemented, and that have been innovative and successful in terms of looking at cultural history, diversity, innovation. And in 8 years, we have been able to have enough technical assistance so that we actually haven't had to fail, which is very unique in the state of California, and I think very instructive for this committee. And it's very interesting to me. I'm with Stacy. I really love the definition, but I want to speak to what one of the commissioners was saying concerning if we have pilot programs, we need to advance on the games. And I think that is particularly relevant to CRDP. So I want to agree with the commissioner about different needs in rural more than different than the urban. And these 35 projects that have been spread out through the state of California do exactly that. And they demonstrate a clear break from the status quo. They've been proven for 8 years. They're already actionable and ready for real world implementation. They have gone through real world implementation. They've gone through all the processes of failing forward, failing fast, and failing small, and have come out to be successful. They're just not widely implemented. And the scaling these community-centered solutions is what is really vital to the state of California, because the state of California has always had the problem of being a majority diverse population, but not being able to address the diverse needs. And the CRDP project does exactly that. So I'm with Stacy. I think it's a wonderful definition. And I just think that we need to stay mindful that the solutions are here. They're already innovative and they're already proven. And when you have a situation like this in California, then I think you don't need to fix what's not broken.
Great, thank you so much. Can we go to the next person in the queue?
Next person in the queue is Mia Cooper. Your line is open.
Hello, my name is Mia Cooper Khan. I'm the Senior Manager of Integrated Health and Community Relations at Alameda Health Consortium. We are the network of 8 federally qualified community health centers in Alameda County, all of whom provide culturally tailored, language concordant, integrated behavioral health services within primary care clinics, with 71% of our patients currently on Medi-Cal and over 75% are people of color. I do agree with Commissioner Fernandez's point around the last bullet, supplanting existing public funding streams. I suggest loosening this point so that programs that have been previously funded that could implement incremental innovations could still be eligible as innovative programs. I would hate to see such programs be disqualified. Also, the third bullet point, demonstrating a clear break from the status quo, could be helpful to define what we mean when we say status quo. Thank you.
Thank you, Mia. I think those are really strong points, and I appreciate you sharing them with us. Grace, who do we have next in line?
Next comment is Joel Baum. Your line is available.
Thank you so much. Again, my name is Joel Baum. I didn't introduce myself before. He and him pronouns. I'm with Safe Passages, which is one of the organizations of the CRDP and also the organization that has led our work around trying to sustain and grow the project. And just building on some of the earlier comments, the reference from, I believe it was Mr. Hall, about the importance of diversity, not just being checkboxes, and what Aba was saying about serving diverse communities. Nowhere in the report as it currently stands, or framework as it currently stands, are CDEPs mentioned. CDEPs are community-defined evidence-based practices. The CRDP community worked very, very hard to make sure that CDEPs were elevated right along with more traditional evidence-based practices in the original legislation around the Prop 1, and we really want to make sure that those CDEPs are uplifted to a great degree throughout this project. They are innovative in and of themselves in that they have focused on the delivery of services to historically underserved populations. And I believe a speaker earlier, Carolina, mentioned the importance of naming things. And in this time when the federal government is targeting so many communities, California needs to stand up and say, no, we in fact do recognize these communities, and no, we are not colorblind. We are not, saying everybody has to succeed, or it's prejudice to focus on certain communities. We have to fight that. I also want to specifically name, the comment about proven results. The CRDP, when all is said and done, was an evaluation project. It was a project designed to evaluate these 35 programs to see what kind of impact they would have. And the evaluation could not be more clear that approaches like community-defined evidence practices, as illustrated in those organizations, is incredibly successful, including on a financial return on investment level. And so I want to encourage us to make sure that we're really uplifting CDEPs and that's showing up prominently in the framework. I also want to name that I'm very concerned about the priority populations that are being named, specifically in the sections W and I, section 58451, specifically states underserved populations, low-income populations, and communities impacted by other behavioral health disparities. And that language doesn't appear to be referenced in the framework, and I wasn't sure why the other broader categories were being mentioned. And then lastly, I do really want to name, there are a lot. I have severely mentally ill family members. I recognize the needs that they have, and we need to do better. My nephew is suffering terribly, as is his family. However, I also want to point out the Internet Patients Partnership Fund is one of the few places where projects that don't require those diagnoses, projects that are falling kind of in between the prevention and early intervention spaces, can be supported and can be found to be funded. And I just want to make sure we're not kind of limiting what can be funded by that definition, requiring those severe mental health diagnoses, because that is problematic. We do not accept the fact that they're only for those populations, and want to encourage us to be really, really thoughtful about who we're saying only for in this document. And then lastly, let me just finish, and then you can. I'm sorry. By definition, meeting the needs of LGBTQ populations and BIPOC populations is innovative, and the CRDP and the CDEPS approach, by definition, have done that, and that makes them innovative in and of themselves, proven and innovative.
Yeah, I think there's a lot that you outlined there that I think is really important. I think we're looking at the definition based on what the statutory language said. So I think we're not in a place right now or with this group to really think about, how do we change that? So, I think we should look at the definition piece specifically. And I hear you on kind of calling out as examples some areas which I think we could begin to lean in on as well. All right, I think we have one more, Imelda.
Yes, we have one last caller or one last participant. Imelda, your line is open.
Great, thank you so much. Good afternoon, everyone. Thank you for the opportunity for public comment. Imelda Vera with Humanidad Therapy and Education Services. We're located in Santa Rosa, Sonoma County. I wanted to reiterate Commissioner Fernandez's point in respect to implementation across California. To respect to our CRDP work, our CDEPs in many ways are the front line for understanding populations across difficult to lens where innovative ideas sometimes lack resources and funding. And I know some of my colleagues here in the call have made some amazing points on that. Again, our CRDP hubs across California are in many ways firsthand to identify these populations and to support to the work that we've done across California. We continue to work innovatively because a lot of the times that's one of our tools to be able to work innovatively with sometimes the lack of funding. Thank you so much.
Thanks. All right, I want to be mindful of time, so I want to be done with this piece by 4 o'clock, if that's okay, Commissioner Sai. So if you could give me 5 more minutes, and then you can use the last 15 minutes. I know we're not going to be able. If we can go back to the slides really quickly, just so that I can at least frame this up very quickly. If you keep going on the slides, keep going. Keep going. Okay, yeah, get through these really quickly. So here are kind of the pillars that, or the priority areas that we've looked to identify. Again, not designed to be an end all be all, but I think something to consider and getting people's feedback and ideas on. And given what we talked about earlier, the goal was really to try to figure out how we tie these with the overarching priority areas that were defined or looking to be defined by this particular committee so that these things all tie together. I think there's more conversation to be had on that particular piece, but just wanted to flag that. And then if you can go to one more, if you can go to 2 more slides. Keep going. So the pillar focus area, so where folks would need to demonstrate that they're focusing on these things would be, and we've defined these in the paper, so you can take a deeper look at that and provide us with feedback throughout this process. But really, how do we anchor in equity? And we define what equity looks like. How creative are you with the financing of your proposal and the sustainability of the financing moving forward? Are there opportunities for you to think about public-private partnerships that further enable? How are you engaging people with lived experience and in the community? And then how does this align with efforts that are already going on with the state? The legislature and the state have done a lot of work in the space rather than replicating or duplicating certain efforts, demonstration that they align. So Again, these things are outlined in the paper. This is the beginning of an ongoing conversation. We'll have more to have, but it may be with the commissioners first, and I know Commissioner Schwartz has her hand up. If we could just get a few more comments on it, and then we'll give it back to Commissioner Tsai.
And Marco, I think we probably are good to go until 4:05 for this. So I think we
Okay,
have a little
great.
bit of time. Yeah.
Great.
All right.
Thanks.
Commissioner Schwartz?
I was curious about why you only had youth in the pillar. I defer to what kind of input we get from the community, but from what I've heard on the implementation of Care Court, the county behavioral directors have been saying that the people that are coming through there or that they see that might be eligible adults in the criminal justice system are the ones who have never had contact with the county behavioral health system. So, like I said, if I'm willing to be overruled by community input, but I do feel that we should include the concept of trying to reach adults who we've not reached with our existing systems. So I would not want to see us only focus on youth. And I would like to take this a little bit of personal prerogative here to go back. I didn't want to mention this, bring it up before, because I wanted us to get to the pillars, but I have a little bit of trepidation about adding too much into the definition that allows funding for existing pilot projects, or ones that have already been funded, because this is not an ongoing source of funding. It's a one-time source. And if we fund projects like that, once the funding dries up, people will come, the community that's being funded will come forward and say, oh, we're losing, you've cut our funding and we're going to have to lay off people. I have experienced this as legislative staff with the budget situation. When we do one-time funding, what happens when it ends is that's what happens. People say, you've cut our funding, when actually it was one time to begin with. So I do want to add a note of caution about funding projects that look like they would be ongoing. It gives false expectations.
Thanks, Marjorie. I think that's an important piece, and I think part of the priority cross-cutting areas was looking at kind of, if we're going to fund you, what does your sustainability model look like that is beyond just this funding grant, right? So I think that could be a metric, but I hear you related to the definition, given the feedback you're providing there. So I think that's really important.
And Commissioner Schwartz, just to address your point on the prior slide where it mentioned those three categories, I think the intention was never to exclude adults, right? I think in general, most of the programs are going to be focused on adults. I think the intention was, and adults would fit under quality and integration, workforce. I mean, it could fit under other categories. I just wanted to highlight that so there wasn't a broader misunderstanding.
Commissioner Cross, I think you might have been next, but if somebody shouldn't fire me if she was not next. I think she was next.
I think I might have been next. I just wanted to speak to the pillar for youth. I do know that there are a lot of underserved community youth that need mental and behavioral health assistance and support. I recently did a presentation for affirming mental health resources for the Black community. The Black community does fall under being a key audience with a lot of programs and projects. But within my presentation, I also discussed, looking at programs for marginalized communities within the marginalized communities. And I think there's always a way to do some type of wording that makes it impactful and more transformational for that type of change in youth in California. There's also a lot of community-based organizations that are available to the Black community, But the issue is that there's a lack of knowledge around these type of resources, which is why I'm happy there's the CYBHI, because that is a public awareness campaign, and that is kind of getting some information out there for the youth, and it also can help build programs. I also just wanted to speak to the fact that youth do deal with substance use disorders, and those disorders can lead to incarceration, it can lead to misdiagnosis, and it can lead to involuntary hospitalizations. So I do think it's really important to, keep fighting for those underserved communities. I do know part of it also mentioned homelessness for youth. I have been to a lot of presentations, but this one presentation I did go to, I learned that homelessness is actually a very traumatic experience for youth, and it's something that has greatly affected their sense of identity. And having that identity be affected, it leads to different mentalities, and some of those mentalities are very unstable. I'll keep speaking to the Black community. We know that the youth mental health crisis, it's real. Suicide is the second leading cause of death in youth. In 2023, the Department of Health and Human Services, specifically the Office of Minority Health, showed data that grades 9 to 12 for whites were more likely to consider suicide, but Blacks, grades 9 to 12, were more likely to actually attempt suicide. So I think it's really important to keep up with prevention and stay focused on early intervention, because I truly think that that's going to save a lot of lives for the youth. So I just wanted to speak to that. I definitely know that adults are also important, but I am here to make sure that we understand that the youth also are suffering and that we need assistance. So just
Thank
wanted to
you,
say
Commissioner
thank
Cross. And if you can share your PowerPoints, or if you have anything that you want to share with us to help us in our refinement of our thinking, that would be super fantastic if you can share that with the commission.
Okay, cool. Thank you.
Okay, Commissioner Chambers, you get the last word before I get fired by Commissioner Tsai. So you've got a minute or so if you want to close us out.
Well, I hope to not get you fired. And I'm sorry that I'm on my phone, but I just wanted to talk about, on the pillars, just making sure that, and I like to think about connection and integration, but just ensuring that things are in community. What I fear is that a lot of stuff is, we're just not focused on community mental health. And so, like, people heal best not in facilities, not in treatment centers, short term particularly, but they heal best in community. I do like the part about the peer workforce, because as someone that's currently practicing, there's not enough clinicians. And then I know that another commissioner brought up sustainability. Like, as someone that's started a nonprofit, implemented a nonprofit, and then saw these innovation funds go through at least the last 10 years of what's happened. I think we need to just find creative ways to support community-based organizations to be able to utilize these funds so that they could integrate into managed care plans or to county systems, or find ways to sustain themselves. I think that is also the innovation, because most of us BIPOC leaders, peer-run organizations, don't have the sophistication, and we are coming for these one-time funds, or we're coming just so that we survive. So I think that if we have a commitment to really building out community providers, then, and really putting the money in the community, then I'm pretty sure the community wouldn't be complaining as much as that we got our funding cut. Because every time I told my staff, I really don't want to apply for another grant, because if I can't get a contract with the county or with a managed care plan, I'm not going to be in business. So I understand what you're saying, and I just hope that since behavioral health transformation is moving to a Medi-Cal model, moving into this system of care, that these funds, that they support the sustainability, particularly of Black and brown organizations that are serving our most vulnerable people who are really do need that money. And we do typically go to the legislator and be like, our funding's cut, because our funding is always being cut all the time, and not just in this setting.
Thank you. Oh, wait, you just cut off. I just want to make sure we didn't cut you. Okay, perfect. So Commissioner Tsai, I just want to pass it back. My urge to everybody is to take a moment and read the working draft that we put out. We're going to iterate on that working draft. We're on version 1.0. The idea is that we're going to continue to build that out based on this feedback, based on community engagement, et cetera. So we will continue to update the website, work with the commission staff to be able to make this accessible to folks, provide us with feedback in writing, and continue to participate in the various processes. So Commissioner Sai, I'll turn it back over to you.
Thank you, Marco. Very helpful discussion. Appreciate discussion from public as well as our fellow commissioners. So we will carry over the decision-making framework to the next agenda. We encourage everyone to have some more time to review that. And then I think we'll move to agenda item 6, which I know that we have to cover today. This is the contract for the California Association of Local Behavioral Health Boards and Commissioners. We'll consider recommending that a 1-year contract with the association be moved to the Budget and Fiscal Advisory Committee for review, and then subsequently placed on the consent agenda at the October full commission meeting for an official vote and approval. Melissa, you want to talk a little bit about this item?
In the interest of time, but just for some quick background and context, and Teresa Comstock gave public comment in the Budget and Fiscal Committee and alluded to the our longstanding relationship with the local boards and commissions, and the commission has contracted with that organization since 2012 to support the training, education, and technical assistance to local board members. The proposed contract for this fiscal year will focus on capacity building around BHSA, including the BHSA 3-year integrated plans and associated performance metrics. And the CAL BHBC supports all the local boards and commissions who support the local community planning process. So we, the commission, see this as a really critical way that to lift up community voice and to inform local planning processes, particularly in light of BHSA implementation. So I think we can, with that, see if there are any questions or comments from commissioners and the public.
Great. We'll start with commissioners. Comments or questions on this item? Hearing and seeing none. Grace, can we open it up for public comment?
Yes, we have one in-person comment.
Commissioner Chambers actually raised her hand.
Yeah. Commissioner Chambers?
Can you hear me? I'm sorry.
Yes, we can hear you.
Go ahead.
I didn't get a chance. Okay, I didn't get a chance to read all it. Who is this? Who runs this organization? Is there any background?
Yeah, so this is the California Association of Local Behavioral Health Boards and Commissions. So it's the kind of statewide association that has membership from all of the local boards and commissions.
So across the whole state of California?
Correct.
Oh, that's cool. Okay, thank you.
Great, thank you, Commissioner Chambers. Grace, open up for public comment.
Yes, in room we have one, Stacy Hiramoto from Remco.
Stacy Hiramoto, I just want to totally support the boards and commissions and Teresa Comstock. She has really done so much to bring the community together and done things on behalf of the entire behavioral health community, for example, in fighting some of the horrible things that's going on with the budget at the federal level. So please support, and I hope they don't have a break in funding. Thank you.
Thank you, Stacy. Currently, we have 3 virtual commenters. The first one, Jerry Hall, you are unmuted.
I think you're still muted.
Hi there, thank you. I'll keep this under 1 minute. I strongly support CalBHPC as well, and I've received a lot of training from them over the years, and Teresa has been fantastic. I think that we really need to rethink how we're equipping CalBHPC with this amount of funding. It's a relatively small amount of funding considering the importance of the behavioral health advisory boards, and that you know, the training is not required. So a lot of behavioral health advisory board members are not trained, and so they don't fully understand what they're supposed to be doing in the first place, which just really hurts the system. So I support this funding and hope to support a conversation during the year to really rethink how we're empowering this organization to serve our community. Thank you.
Thank you, Jerry. And our final comment is from Teresa Comstock. Your line is open.
Hi, this is Teresa Comstock. I'm the Executive Director of the California Association of Local Behavioral Health Boards and Commissions, and just wanted to encourage you to support this and also to think about for the future to, now that you have this committee structure, it is important for small organizations that have small contracts to have those contracts in place so that we can have that funding in our budget. And because of the structural changes you've made with your commission, our organization is being impacted by that. So it's going to be, it looks like a few months out if your full commission isn't going to be voting on this until October. And our last contract ended June 30th. Thanks.
And that concludes public comment.
Okay, great. Thank you, everyone. So with that, we can entertain a motion or a recommendation for the PAC committee to vote on this item. So you can see the proposal on the screen here. Any commissioners?
We need a motion.
Yes.
Any commissioner can move.
I move to motion.
Thank you, Chair or Madrigal-Weiss. Do I have a second?
I second the motion.
Thank you,
Great.
Commissioner Fernandez. We have a motion and a second for the proposed recommendation that is on the screen. I am calling out, please unmute your microphones, commissioners, so that I will take a roll call vote right now. Commissioner Baer.
Aye.
Commissioner Burnick. Commissioner Chambers. Commissioner Cross. Thank you. Thank you. Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Chair Sai.
Aye.
Vice Chair Madrigal-Weiss.
Aye.
Motion passes.
Great. Thank you, Sandra. Thank you, everyone, for joining us for our first meeting. We're almost on time. Did want to remind everyone that in the coming months, we will be hosting 2 listening sessions to support ongoing discussions and efforts around the IPF, the Innovation Partnership Fund. Would encourage everyone to attend those. And with that, we can adjourn. Thank you, everyone.
Thank you.
Thank you.
Thank you.